everyone. Welcome to From London with Love with me, Lean Clive on ALB UK TV. Today, we will discuss a topic of interest to most women, the new advances of non-surgical aesthetic gynecology treatments. What are the benefits? Can it really change women's life to the better? I imagine there will be plenty of women out there wondering, firstly, what is it? And secondly, what are the advantages of non-surgical treatments over surgeries? Could it provide a cure for some symptoms and make them look younger and healthier? Today, we are joined by Dr. Nadia Yousri to answer all these questions. Hello, Dr. Nadia.
Hello, Lady. It's a pleasure to be in your program.
Thank you so much for joining us today.
Thank you.
Dr. Nadia, could you tell us a little bit more about your background, please?
Certainly. I am an OB&GY surgeon, triple qualified in OB&GY, and fellow of the Royal College of Obstetricians and Gynecologists. I've been working in NHS top university hospitals for more than 22 years. And
experience?
in the OB&GY department. So I specialize in the treatment of subfertility, sexual wellness, laparoscopic surgery, and recently I added to my practice the aesthetic gynecology procedures as a treatment for gynecological problems. I've been always my father was a doctor, and I wanted always to be like my father. He's my role model, he's my hero. So I'm always amazed by his dedication and devotion to improve the quality of care to his patients. I remember he really has got always noble missions. So I think he came to my school and he decided to do screening and checking for the children in the schools. And I was watching him, and actually, to his surprise, I rushed to help him and bring him the tools for him, because for a while I now remember the sequence of how he examines my peers. So I just helped him, and I think from that time I wanted so much to be like my father as a doctor and follow his track. So he actually supported me, and he is my mentor. And I managed to go into the medical school and studied up to the postgraduate. I've taken high qualification like master degree, the PhD, and then the Royal College qualification, starting from membership up to the fellowship now. And always I'm trying to keep going with improving my skills and my knowledge, always in quest for that. So that's it. That's my background.
And today you are joining us from an NHS medical center. We wouldn't mention it, but you are doing both. You are doing aesthetic gynecology, and you still within the NHS serving.
NHS is my home. It's the proper organization. We're all proud to be part of it, and I think it did very well in the past few months with the pandemic. So it really, it held itself and held the nation, all over, You
are one of the heroes out there.
Thank you.
So Dr. Nadia, what inspired you to move to aesthetic gynecology practice?
Excellent, very good question. From traditional OB&GY, really very traditional. As a doctor, I always follow the recent advances in medicine in general. And in particular, I was fascinated by the regenerative medicine. It's an up and running specialty for decades. And really, they have successful results in other medical subspecialties, like the sportive medicine, treating injuries, or orthopedic, or arthrology, which is joint pains. They really have got good results, and they backed up with a gravitas of evidence-based research and studies. The principle of regenerative medicine is very nice, which lies on stimulation of the regenerative cells of the body to, with the growth factor, to rejuvenate certain area through increasing the blood flow, increased collagen formation, cell replication, which ends leading to new tissue formation, healthier, younger, robust tissue formation. That's why we regain the function and the appearance. So I thought it's a fascinating principle to apply this in the gynecology. So because in gynecology, traditional gynecology, we have got only surgical option and hormonal option, medicinal treatment, and then pelvic floor exercises, or conservative, or doing nothing basically. Yeah. All of this has got pros and cons and limitations on success rate. So it's really limited between that. With the regenerative medicine, I think it treats more than that. It provides radical treatment more than that, because it removes the damaged tissue and replace it by healthier tissue. So instead of working on half damaged tissue, trying to repair what you can do, you just really get this completely into a very new, brand, youthful tissue, like if rejuvenation again, which is very good. It's a good treatment.
So is that why you think people prefer the non-surgical procedures now to the surgical ones?
Absolutely, because I decided to introduce this to my portfolio of experience and offer it to the ladies as to broaden the scope of options in front of them. So really, I think it will be expanding, and that's why through your program, then I talk to the audience, ladies, and they just tell them they don't need to suffer in silence, because, or the fear of there are only limited options and the fear of surgery. No, there are other non-surgical procedures, plenty of them, that can help to successfully treat their symptoms as equal as even the surgery, which is the top one.
So when we say for women to go to aesthetic clinics, do you advise them to go after childbirth, or like what time, if they are thinking of it, when do you think it's the best for them?
Very good question again. First of all, the regenerative principle can apply anywhere. So the age group, it's various age groups, starting from the young ladies who wanted to keep the appearance of the intimate area. So they can, I prefer now not only treatment, I would like to introduce it as a prevention as well. Why you have to wait until the damage happens? Why try to regularly try to rejuvenate? So, for example, because of the ladies, they go through many events in their life, starting from pregnancy and childbirth, and then another childbirth, etc., and then the menopause.
Yeah.
So the childbirth, it's the most important event in a woman's life, creating a beautiful new life into our world. However, it could be tough on the woman's body because of the hormonal and the physiological changes that happen with pregnancy. Sorry. Yeah.
I wanted to ask you, you mentioned the menopause. I want to ask you about the dysfunctional symptoms that occurs during menopause.
Absolutely. With the menopause, we have got two factors, I'm afraid. Time, which is aging, and the declining of the feminine hormones called estrogen, which was supporting the tissues and the blood flow. This will lead to, in the face, for example, they will have shriveled skin, wrinkled skin, loss of texture, sagging skin, and loss of the fat. padded fat, of course, and the hair, for example, start to fall down because of the reduced blood flow. What happens here happened there. So they will have in the intimate area even worse. So the outside structures, they lose the skin will be shriveled, loss of the volume and shrinkage of tissue. The function, which is very important, the opening of the birth canal will be lax, weakened. The muscles around it will be weakened as well. So the lubrication function will be drying off because the glands really now declining function because of, as I said, reduced blood flow, and the collagen stopped completely. You know, the collagen and elastin, which are the components of the connective tissue that hold the structures together. They stopped from the age between the 30-35 and declining even that every year by 2%. So imagine me 20 years ago better than. So anyway, so all these will weaken the area. You will have the muscles will be weakened. So the muscles are supporting the structures in the pelvis. For example, the bladder. So the bladder will sag down, leading to difference in mechanics of closure pressure between the bladder muscle and the urine tube. So she will have a leaky bladder, I'm afraid. When she coughs, sneezes, or laughs, or running, or jumping, she will leak. Or she has got overactive bladder, irritated. So after drinking some fluid, she will feel like the urge to go, and she loses some urine in her way. Also, she will have laxity in the tissues. So this laxity will lead to diminished sensation, which is negatively affecting her intimate relationship, her self-esteem, and the sense of well-being.
So we are here talking about shape, but also we're talking deeply about function.
Function is very important. Shape is a bonus that comes with aesthetic. That's why, very good point, aesthetic gynecology is a misleading
yes, when we say the word aesthetic, people will think straight to shape or look.
Exactly. No, it's not the appearance, I'm afraid. It should be called functional or restorative or regenerative gynecology. That's what I'm pushing through, because it's mainly functional. We're not gratifying the appearance. It's not appearance, it's not all about the appearance. The most important, this menopausal lady who feels dry, have got the birth canal dryness, so she feels chronically irritated and burning sensation and pain during intimate relationship, and even the tight clothes is causing her discomfort. Quality of life is that. So if you help to restore the lubricant function and the pushing effect of the external structure back, that's you regaining the function and the quality of life of this lady. Appearance comes as a second bonus, but it's not really the main thing. Same on the childbirth, because you asked about the childbirth. With the physiology and the hormonal effect and even the mechanics of labor, with the stretch of the opening of the birth canal and the surrounding muscles, after birth we should recoil back to the initial status, but maybe after one birth, because of big size baby or difficult instrumental delivery, God forbid, or after several birth deliveries, the tonicity and recoil will be lost. So, and also adding to this, maybe she sustains birth injuries like tears that happen, I'm afraid, during delivery. One of the things they have to pay the price of having the child. With these energies, it affects the energy to the pelvic floor that really supports these structures again. So she have again bladder dysfunctions, She will have, in the future, mild sagging of the tissue, might prolapse. She will have diminished sensation. She will have laxity that lead to, of course, intimate relationship dissatisfaction of both sides. So also with the pregnancy, there is a drop of estrogen level. So during pregnancy, she will have vaginal, she will have got the birth canal dryness because of the drop of estrogen level. She will have a pseudo menopausal status, believe it or not, because of that, and also continues if she continues to breastfeed.
Yeah.
So all this will have a negative, of course. Yeah. So this is a quality of life with ladies. So what talk about quality?
Yeah, we talked about the problems. Now, what are the non-surgical aesthetic treatments?
Absolutely, that's very good. It's first of all, it's a new category that really variety of modalities, which that's the beauty about it. So we can start with platelet-rich plasma. We said the platelets are the regenerative cells, and the plasma contains growth factor. So injecting this in the intimate area and the strategic points will help to rejuvenate. So the idea of non-surgical, they are non-surgical because they are non-invasive or minimally invasive. So we have got the platelet-rich plasma injections, where we have got stem cells injection. We have energy-based devices like use of radio frequency or laser, and also hyaluronic acid augmentation. So, for example, we can do non-surgical labiaplasty, non-surgical vaginoplasty. We can do the outside augmentation, outside structure augmentation, when we lost the volume and become flat and painful, discomfort. And we can do G-spot amplification, because in traditional gynecology, they don't even think about the G-spot. They don't even recognize its presence. It's an area, small area, that contains neurosensory cells, which is important. So with the non-surgical, we can do more than even the surgery can do. You asked about the advantages of non-surgical over surgical. Yeah, imagine we are improving the quality of the ladies without resorting of surgery, which is invasive.
Yeah, and downtime and
recovery time. Yeah, about 6 weeks. It may end by scars later on. Lengthy preparation, costly, and the results are not. They are longer lasting, but might be repeated. Also, the downtime, the analgesia, you need general anesthesia. All that can be exactly the opposite in non-surgical. So there is non-invasive, no downtime. So we call it lunchtime procedure. So we have the procedure within 30 to 1 hour, less than 1 hour. She can go to her work, to her studies, her home, taking care of the children. So nothing. There is no downtime, or even in 2 or 3 days. The results may take longer than the surgery, but the surgery has got the recovery time to 6 weeks. But she might have 2 or 3 sessions, but in some of these procedures, you might have an instant results.
Dr. Nadia, we talked about the type of treatments available and their advantages and benefits. It's just like I have a question in my mind. So if there are like non-surgical treatments out there, and their benefits I overcome their negatives, why you think the woman might not go to do it? Like, why you think there are still women kind of neglect or avoid going to any type of treatments, even though there are lots of treatments there? Do you think it's because there's not enough education and awareness about it, or what can restrict the women from going there more?
Absolutely, information, because it's taboo generally. for generation, ladies were raised on not talk about this area at all, or the dysfunctions. And some of the ladies, even as doctors, we try to ignore that, because in traditional medicine we haven't got much to help these type, like laxity of the birth canal. Or what can we do? I can offer surgery, that's it. If she declines surgery, fine, you know. So as I said, it's the taboo and the conservative, reserved nature of the women, and they know from their ancestors that there is no much to be done. Even the gynecologist and the doctor, they don't talk about what other options. They don't know, because also they think it's the limitation of the treatment we provide, and more importantly, they think that's the price they have to pay for being pregnant, or they have to pay because they're getting old. So that's it. No, that's not the case. There are other methods, many procedures. We can get them, even for the lady who is, for example, she gave birth and she wanted more children in the future. But in the meantime, why not enjoying a nice quality of life in between? So that's one thing. Also, the lady who is menopausal or perimenopausal, one, she has to suffer. If she regenerates and remove these damaged tissues, and we have got younger, stronger tissues, that's it. That's what we know. So that's what I'm trying to reach out.
Yeah, I remember when I contacted Dr. Nadia, her main aim of the show is to educate women. And it is a topic, to be honest, is like new for people, like they prefer not to talk about it. So I really appreciate you took some time off, and you are joining us to spread the message.
Absolutely. It's my duty to do that. And I always, when I meet even the ladies and everywhere in my clinic, I talk to them and tell them the options. And now I'm very proud to say about the non-surgical and invasive, because I can see the women now, they are onto non-surgical and non-invasive. So I predict that will be expanding over the next few years, and more women will be aware of it. Exactly.
So, doctor, can you offer like a combination of several treatments for one patient? Does it happen normally?
It does, to be honest with you, because what is important about these aesthetic gynecological procedures, they need the knowledge of a gynecologist. Because every patient or every lady needs assessment of her own condition. So is it, first of all, what we call case selection? How can I help her with more and personalize or customize the plan of care to get for her the best results suitable for her, the highest result I can get? So I can, as you said, use combination, because it depends on the quality of tissues, and then not only one symptom she has, she might have 3 things like laxity, bladder problem, diminished sensation. So one thing is not enough to cover, like the surgery. Surgery can help in tightening the birth canal, but doesn't help in the dryness, for example, or the quality of tissues. But with the regenerative procedures, you can apply 1 or 2 procedures to cover 2 or 3 problems or dysfunctions. So most of the cases we do that, and also to enhance each other. Like you have got, for example, you have got 2 medicines, they both synergistically help each other to enhance the effect more. So it depends on, as I said, my assessment, or the gynecologist, not me, the gynecologist who knows the broad spectrum and how can he sit, or she or he, the problem of this lady particularly, into the sequence of the problems, and which one which plan of care he or she can devise for her. So that's the point. So it's not aesthetics. Not everybody plays with a machine gun.
that took me to the next question. Like, so it needs to be a gynecologist.
Preferably.
To do it for you. That's also a very important message, to not also mislead women.
It should be a doctor. That's my at the minimum, actually, that has got very good knowledge about it, because the intimate area, it has got sophisticated anatomy and physiology, and the micro details of the anatomy and physiology in this area are owned by gynecologists rather than GPs or even plastic surgeons. I'm a surgeon myself, and I've got great respect to all my colleagues. They do a brilliant job. But in this particular area, it's really very specialized, and dysfunctions in this area are beyond the realm of GPs, for example, and are reasons for referral to specialized centers. So also, because I know even the dysfunction, you said bladder dysfunction, it's not simple. It has multifactorial elements. So the gynecologists, they know which one and how can they deal with the complex problems.
Yeah.
And I guess even the population, the people, the lay people would prefer to have a specialist treating them. For example, if any problem with the eye, they go to the eye specialist. In the ear, not really. So because they know they are on the top of the knowledge in this area. Also to avoid complications.
Yeah.
Mitigations. So if you know what are you doing, then there is no risk of complications. You'll have the experience to avoid that, and you get only that, not only that, you get the highest maximum success rate for this lady.
Dr. Nadia, I will finish with the last question, which I think every woman who's watching us today will be thinking of. In regards to side effects or safety, if it is done, of course, as you mentioned, with a specialist. So what is there, like, any more ideas or more things to tell us about the safety side of it, a side effect, like what can go wrong? That's my in any of the treatments we mentioned, just also to show a full image about the treatments.
Very good. The best thing, that's why it's not in the NHS, because this treatment is not on the NHS, I'm afraid, because they label it as aesthetic. They are,
yeah.
So the least, because they have got the least complication, to be honest with you, in their experiences. So you have got the minimum risk of infection, which could be a common thing with surgery. They have the minimum is maybe there is no result if you are not really trained or just injecting blindly. So you just inject, but there is no certain points you have to inject. That's the minimum. And also using of energy-based devices like laser and radio frequency, though the manufacturers are marketing them as safe, anybody can operate,
yeah.
But the longer term and how to use it particularly, in my opinion, remain to be monitored very well and guarded by the gynecologists, because they know exactly where they apply, what's the energy
yeah.
The device, and how can apply this device in this area, and how to improve, for example, the bladder symptoms rather than the rest, for example. That's certain multi-dimensional type of knowledge, but the risks are really minimal. There is no risks whatsoever, to be honest with you. That's the beauty of the non-surgical, non-invasive aesthetic gynecological procedure.
Dr. Nadia, thank you so much for being my guest today. It was a pleasure meeting you, and thank you for taking off your time to be with us today.
Thank you very much, Lynn, and I'm really one of your fan of your program, and really beauty matters. And also, I think it's very informative for the audience. I'm really pleased so much to be with you today. Thanks for having me today. Thank you.
I'll learn from you. Thank you so much. And now, for my audience, we're going to go to watch a video to know more about Dr. Nadia and to know more about gynecology aesthetic. And I will see you next week in a new episode with From London with Love with me, Link Live on ALB UK TV. Stay safe.